Welcome to the Statewide Prevention Convening orientation video brought to you by Strategies Technical Assistance. This video is meant to orient new prevention team members to the prevention work that has occurred since 2019. While each county has its own unique journey, this video provides a statewide perspective and context for overall prevention efforts in California. All links referenced in this video will be provided in the caption. After watching this video, you will be able to understand your role in child abuse prevention, amplify your voice in local prevention efforts, understand the key components of the comprehensive prevention plan, and learn why prevention is so important. In this video, we will review a background on prevention efforts in California, the Family First Prevention Services Act, the Family First Prevention Services Program, and the Comprehensive Prevention Plan. We will also get an overview of funding, the protective factors and social determinants of health as it relates to prevention, community pathways, and what's next. Why focus on prevention? Ensuring the health, well-being, and quality of life for children and families is crucial in preventing child abuse and maltreatment. The economic and societal consequences of child abuse and neglect are profound, but preventive services can help alleviate these long-term effects. Before we talk about the history of prevention in California, let's define what we mean by child and family well-being. When families are healthy, safe, and economically stable, their children's health and well-being can thrive. This includes physical, economic, and social well-being, development and activity, emotional and psychological well-being, life satisfaction and domain-specific satisfaction, and engaging activities and work. Now, we will review the background on prevention efforts in the state of California. Prevention planning discussion began after a presentation from Dr. Robin Jenkins to the Child Welfare Director's Prevention Cabinet on the value of prevention. This presentation sparked a discussion about planning a statewide prevention summit where cross-collaborative county-led teams could begin to imagine prevention at the center of their child and family well-being systems. In preparation for the summit, counties had to develop cross-collaborative teams that included community partners such as First Five child abuse prevention councils. 33 counties applied and 22 were selected to attend. In January of 2019, 225 participants from 22 counties attended the first prevention convening, where topics related to the importance of prevention were discussed. Teams also had the opportunity to share successful prevention programs and strategies, as well as create an action plan for their counties. This timeline illustrates the convening events that have occurred since then that have helped teams build their capacity in prevention strategies and connect to the statewide network. Let's talk about the legislative changes that made all of this possible. The Family First Prevention Services Act was included in the Omnibus Budget Reconciliation Bill in February of 2018. It went into effect in October of 2019 and provided major changes in foster care funding in a generation. This bill provided prevention services in their entitlement along with funds for children in care. California was required to submit a 5-year plan to opt in to the Family First Prevention Services Act funding. They submitted their plan, which has been approved. California then passed AB 153, which created the State Block Grant Program. The state block grant allowed expanded prevention services to families and children in counties with the requirement of creating a cross-collaborative comprehensive prevention plan. Counties had to submit their plan by July 31st, 2023. These plans had to include primary, secondary, and tertiary services. In April of 2022, counties were offered the opportunity to opt into the Families First Prevention Services Program with a promise of the state block grant that could fund primary prevention activities. So, what makes up the California Family First Prevention Services Program, or the FFPS? Federal Family First Prevention Services Act, or FFPSA, plus FFPS, plus a comprehensive prevention plan equals the Family First Prevention Services Program. We'll talk a little bit more about the funding that goes into this program. The Family First Prevention Services Act, or FFPSA, is federal funding that supports services to families to keep children out of the child welfare and juvenile justice system. It provides support to families and children at risk of maltreatment or when child maltreatment has occurred. This funding covers secondary and tertiary preventative services such as wraparound services, home visiting, and adoption support. This program requires the use of evidence-based practices. The Family First Prevention Services Program, or FFPS, is state funding that supports services and programming for a universal audience, otherwise known as primary prevention. Primary preventative services include health education, legal aid, parenting classes, and food banks. It does not require the use of evidence-based practices. Counties are also utilizing other preventative funding sources such as FFTA, Family First Transitional Act, Community-Based Child Abuse Prevention, otherwise known as CBCAP, and ARPA, American Rescue Plan Act monies. The difference between FFPSA Part 1 and FFPS program is that FFPSA authorizes the use of federal funds to reimburse states for specified prevention programs for children considered at imminent risk for entry into foster care. The state Family First Preventative Services Block Grant authorizes the use of state funds to support prevention activities in primary, secondary, and tertiary populations. This funding expires 6/30/28. So, what is a comprehensive prevention plan? A comprehensive prevention plan creates a system where all families can access the services and supports they need. It requires family strengthening organizations such as community based organizations, family resource centers, and county social and human services departments to collaboratively align efforts and center overall child and family well being. So, what does prevention mean? Comprehensive prevention plans address three levels of prevention strategies. Tertiary, the top level, are services that provide interventions for children experiencing maltreatment. Secondary preventative services or programs provide to alleviate identified problems and to prevent intervention. Primary prevention services and activities are targeted at the entire population to provide information and support before a problem arises. Prevention could not happen without the collaborative efforts of an entire community. Suggested and required partners were defined in the All County Letter dated April 2022. Prevention teams were required to partner with community organizations such as child abuse prevention councils, tribal representation, foster family agencies, and former foster youth. CDSS, the California Department of Social Services, also listed suggested partners in the creation and implementation of the Comprehensive Prevention Plan. All prevention activities and services utilizing FFPSA funding are required to utilize evidence-based practices. A list of the evidence-based practices selected by the state of California are listed on the California Evidence-Based Clearinghouse website. Here are just a few examples. The Comprehensive Prevention Plan aims to serve the highest risk groups. Some of these groups are Native American, American Indian children and their families, LGBTQ youth, children and families receiving voluntary or court-ordered services, children with substantiated or inconclusive cases of reported maltreatment, homeless or runaway youth, substance-exposed newborns. The protective factors is a framework utilized by many counties to guide the interventions offered in their communities. Protective factors are characteristics or strengths of individuals, families, or communities that mitigate the risk and promote positive well-being and healthy development. When families demonstrate competence in these 5 areas, the chances of child abuse and neglect decrease and the likelihood of developing a healthy and supportive environment for optimal child development emerges. The 5 protective factors are concrete supports, parental resilience, social emotional competence of children, social connections, and knowledge of child development. County prevention teams also incorporated the social determinants of health into their comprehensive prevention plans. The social determinants of health are identified as conditions in which people work, live, and play. As we improve them for communities, we help increase the health and wellness of communities. We also understand the connection between healthy, thriving families and the reduction of child maltreatment. Here are some examples of social determinants of health connected to primary prevention strategies. In education access, services such as universal preschool and parenting classes, healthcare and quality, health insurance and health education. In neighborhood and built environment, access to grocery stores, community beautification. For economic stability, subsidized childcare, food banks and cooperatives, and in social and community context, school-based programming, family resource centers. The California 5-year prevention plan identifies 3 pathways to prevention services: child welfare through hotline contact with the child and families where a case is referred out for services, families voluntarily receiving services or families in family maintenance, probation youth and their families. And the third pathway is the community pathway, where children, youth, and families can receive early intervention services at the earliest point as possible to minimize the stigma of working directly with child welfare. The plan delineates where referrals can originate and who may be eligible to provide services. Referrals can come from child welfare, probation, the youth or family, or school. Services might be provided by a contract community-based organization, evidence-based practice provider, or a non-child welfare public agency. Here is one example of the community pathway. In this diagram, a family comes into a community-based organization like a family resource center for help. A service provider would determine Title IV-E eligibility based on child welfare guidance. Next, the provider would determine, based on the results, if the family requires support through the Title IV-E agency. They would develop a prevention plan, and the family would receive services along with case management. Are you interested in becoming involved in your county's prevention efforts? Here are some questions that can help direct you to your next steps. 1. Do you know what's in your county's comprehensive prevention plan and how to participate in the implementation process? 2. Are you signed up for Caltrans Strategies Technical Assistance and Family First Prevention Services email alerts? 3. Do you need more information about the comprehensive prevention plan in your county? 4. What might you contribute in supporting families in preventing child maltreatment? The following websites can offer comprehensive information on the Families First Preventive Services Act as well as the Family First Prevention Services Program: the California Department of Social Services, California Training Institute, and Strategies Technical Assistance. Thank you for watching this video. Please feel free to search this video on YouTube